Yes.
Okay. So another category of blood vessel pathology is what happens if the blood vessel walls get weak. And that's called an aneurysm. It's a localized arterial dilation. So it usually is going to involve um, all three layers of the blood vessel. It doesn't necessarily have to involve all three levels, but it typically is going to involve all three levels where there's a weakening in that blood vessel wall. So, so typically our blood vessels should look nice and straight, and it's got a tunica media that's nice and thick, and then a nice little connective tissue outside layer. Now, in a situation where we get one side that's looking all right and another side that bulges out, so what we're going to see is we get a little bit of stretch and weakening on the one side. And this type of aneurysm is called saccular when it's just weakened on one side. If we get a situation where both sides are affected, so we're gonna get a little bit of stretch. So I'm exaggerating the thickness and trying to show the thinness in the middle. So we have nice thick and then thin. So you can appreciate that if we got thin where we were thick, it's weakened. On both sides, it's called a fusiform aneurysm. And then you can have a pretty distinct looking one that is called a berry aneurysm. So it just looks like there's a little bit of a berry that's burst out of the wall. This is not uncommon to see. If you're going to see an aneurysm in the brain, it's often described as a berry aneurysm. So it's a little pouch-like extension. So this is just what they look like under under visualization. We like a nice patent lumen, good strong walls. That's what we expect. And anytime we see a variation on that, it's a dilatation when it expands outward and it results in weakening. And what we're concerned about is that it may be prone to rupture. And you can appreciate that if it's in an artery and it ruptures, there's going to be a lot of bleeding. It's under high pressure and there's a lot of bleeding. So the way it presents is going to depend on its location. If it's in the cerebrum, so it's associated with cerebral arteries, then because we're in a relatively confined space, it's probably going to be symptomatic. Not always, but probably going to be symptomatic, and especially noticeable whenever we increase cranial pressure. So the patient is probably going to complain about headaches, pressure, and headaches, and on an angiogram, the aneurysm may show up. Otherwise, it can be asymptomatic. If it's aortic, then one of the places that it's likely to be visible and identifiable is in the abdomen. So the aorta typically travels from the heart, behind the heart, travels through the thoracic cavity, leaves the thoracic cavity into the abdominal cavity. And because the contents in the abdominal cavity are soft tissue, except for the vertebral column posteriorly, then it's sometimes the expansion is visible in the abdominal cavity. I mean, I was a chiropractor before I was a professor at Seneca, and I had a number of patients over the years that I was able to identify with an abdominal aneurysm on my chiropractic table. And I got them off that table fairly quickly and recommended that they get over to Emerge to get proper follow-up. But basically, it was visible. The pulsing in the abdominal cavity was visible, indicating that they had an expanded abdominal aneurysm. And the concern is if an aneurysm ruptures and it's aortic, the bleed is going to be so dramatic and so quick that there isn't going to be very much you can do for that person unless they're already in the hospital. And even then, the rapid loss of blood is going to be pretty dangerous, pretty life-threatening. Now, there is another type of aneurysm that's called a dissecting aneurysm. And what happens in a dissecting aneurysm is we can have our expansion, possibly undiagnosed expansion, and we have our tunica media and our tunica media, or externa. And what happens in this scenario is we can get an interruption in the intima and possibly the media. But what's going to happen is the blood, so I'm going to make the blood green, and I'll show you why in a minute here. Let me get the other side of the blood vessel in. Other side of the blood vessel, and I'm going to close it off. Okay, and I'm going to close off and then we're going to up with turquoise blood. Okay, so that's the blood that flows in our blood vessel when the intima is intact and the media is intact. Now, if for some reason we interrupt the intima, then now the blood is able to flow into this space. And the dissecting part comes from where the blood flows in and separates the intima from the media. And it fills up that space. And once that separation starts, it is very rapid in its progression. The pressure from blood flow is very rapid. And it either separates between the intima and the media, like we've shown in this picture, or it could separate between the externa and the media. But the dissecting part refers to the fact that the layers are being split, and it travels up and down from either side of the opening that created the dissection in the first place. This is very much life-threatening. Leakage between the layers is rapid. It causes a separation between the layers. That's dissection. That's going to be painful. It leads to rupture, and if you get rupture, it causes death. I was telling the other group that there was a famous case of this. Maybe it's about 10 years ago now. There was a guy who was an actor. His name was Alan Thicke. And his son, his name is Robin Thicke. Some of you might know Robin Thicke. He's a musical artist. He's a musician. He's a host on a TV show right now. It's a stupid show if you ask me, but it's called, what's it called? Something about a mask. The Masked Singer. You know the show I'm talking about?
Yeah,
You know the name, Robin Thicke? Do you know that guy that I'm talking about?
I think so.
The singer? Anyway, he was the son of an actor. The dad, Alan Thicke, was playing pickup hockey. He was an older guy. He was in his early 70s, maybe late 60s. And he was playing hockey, and he complained of some chest pain. They thought maybe he was having a heart attack. By the time they got him into the ambulance and got him to the hospital, he'd had a dissecting aneurysm that ruptured, and he died. So it was kind of famous, and I've sort of used it as an example because some people, at least, know the name Thicke, Thicke. Alan Thicke was actually Canadian, but he was famous as an American actor that died of this dissecting aneurysm. There would be lots of other examples, but this one is, you know, reasonably um, recognizable. Maybe not so much to you guys, but to us anyway. So the diagnosis is going to be from either a CAT scan or a magnetic resonance image. Otherwise, it's going to be hard to find and is often asymptomatic until it ruptures. So it's a problem as far as that goes. Any of these aneurysms, as far as that kind of description goes. Okay, so I think this is about where we finish with the other group. So we'll be consistent. We'll finish here, same as the other group. So what will happen is after test 2, I will talk about some blood pressure issues, high blood pressure, low blood pressure, and then we'll get started on the heart and see how far we get before we're finished on next week. And then we have a break for a week after that.